Do you think it's possible that there are kids out there who actually get excited to go to the dentist? Well, we are here in beautiful Boca Raton, Florida at Maye Pediatric Dentistry and Associates. We're gonna go check out just how this phenomenon has come to be. Let's go check out their child-friendly environment. We're with Dr. D. Thank you so much for having us.
Thank you so much for coming.
We want to know, what is the difference between a pediatric dentist and a general dentist?
As a pediatric dentist for almost 10 years, we are trained to provide the highest quality of care in a fun, supportive, and comforting environment for the patient.
And when you say patient, like what age do most kids need to come to the dentist?
The American Academy of Pediatric Dentists recommends at age 1, mainly to allow for the parents to gain some information as to what to do from 1 to about 18.
What is the most important piece of advice you would give to the moms and dads out there?
I would say that flossing is very important, especially for baby molars, mainly because the most common cavities that children get are the in-between baby molars, and so I would start flossing at age 3.
Age 3, important. Thank you so much.
You're welcome.
Hey, Dr. Maye, thanks for having us.
Thank you.
So we want to know, how long have you been in this location?
We've been in this location for about 10 years now, and we've been in Boca for about 13 years now.
Wow.
It's going great. The location's been really expanding. Business is growing. It's been a lot of fun. It's going well, thank you.
Amazing. And what would you say differentiates you from other pediatric dentists?
I would say our main differentiation in this location, in this practice, is we offer sedation dentistry that unfortunately a lot of others are not capable of doing. So we're primarily one of the main locations in Palm Beach County where a lot of the other offices will funnel to us for sedation. So with that, we get the ability to offer either IV sedation, usually once a week with a pediatric anesthesiologist that comes in. And then about 9 years ago, the government started letting us know that a lot of the lower socioeconomic kids, or just kids in general that have very high anxiety or maybe a medical issue that doesn't allow them to cooperate in the chair and they need extensive dental work, we're one of the few offices in the state that's actually able to bring these kids into the hospital, have them go to sleep, and again, get all the work done in one visit. So much so that we're actually doing surgeries, about 100 surgeries a month now, and we get patients from the entire state of Florida that travel down to us for this. So it's quite a blessing. We're really happy to be able to offer that for the kids. It's sad that so many kids need this treatment and that there's not enough dentists out there to be able to keep up. But together, between Dr. D and myself, we're capable of getting a lot of these kids done, and it's very spiritually rewarding and helpful for everybody in general.
And for the kid, I mean, he goes to sleep, she goes to sleep, wakes up, and it's all done.
It's so much better. And for the parent, too. I mean, for the parent, look, it's a nervous experience. The parent's going, oh my goodness, we have anesthesia. But then this poor child, the only other alternative is holding this poor little kiddo down and having him hoot and holler throughout the whole experience over multiple visits. So a lot of these, picture a child that's 3 years old and needs 8 root canals and crowns. Can you imagine them sitting there for 4 visits with crying and the poor parent having to see that? What this allows us to do is the child sleeps through the entire experience. They wake up, they remember nothing, and all they have is like a mild sore throat for a day, and then they're done.
And Dr. Maye, for the children that don't need sedation, tell us a little bit about the fun environment here.
Perfect. Like you said, we're going to treat all aspects. And yes, we do have a subspecialty for sedation patients. But like you said, not everybody's going to need it. The true answer is the majority of the patients do not need sedation. About 20% of the population gets the cavity. So there's 80% of the population that we're seeing here that we're not doing sedation on. At that point in time, we still want to make it as easy and as fun as possible. So we have TVs on the ceilings for the kids. The office is set up with a whole jungle atmosphere. There's an arcade in the front that's got about 10 arcade games that are free for the kids. You might find the parents in there more, but it's still a fun experience. Let's say you have a little 2-year-old that doesn't want to hold still. We don't want it to be frightening for them, so we have a separate room for the little kids where we'll unite with the parent to make a united front. Ultimately, at the end of the day, our philosophy here is we want to get the job done, but we want it to be in a completely atraumatic fashion where it's fun and enjoyable for these kids. At the end of the day, all our goal is they're going to be 18, they're going to go on, You might not love the dentist,
Yeah.
but we want you to be able to be confident and assured of yourself and sit in a chair and be able to get everything done. And that's our goal, so we try to make it as fun as possible here.
You start the roots real young.
Real young,
Yeah.
thank God.
That's awesome. Thank you.
You're welcome.
We are with the Mowberry family. Thank you so much for participating. How long have you been coming to Maye Pediatric Dentistry?
We've been coming here for 9 years. I think 9.5 years.
And tell us a little bit about your experience.
It's always been a good one, always positive, a lot of fun. The girls are really, really nice. And Dr. May's always in a good mood. So it's been really good, always positive.
And what's your favorite thing about coming here?
Well, it's a lot of fun and the people are just so nice.
So you look forward to going to the dentist?
I do.
Aww. And what about you?
I like the dentist.
You like the dentist because he's nice?
And he fixed my tooth, so it's good.
Two positives. So Karen, I understand you drive all the way from Coral Springs just to come here?
Yes, we've been coming to Dr. May's for years. I love the staff. They know all of me. I have 4 children that I bring here. We see him and the whole staff is great. As soon as we walk in, they welcome me. They know exactly who we are. I don't even really have to check in anymore. It's great.
Amazing. Breezy and baby Essex over here. How did you decide that Maye Pediatric Dentistry was going to be his dentist?
Well, we always knew that we would end up here because my husband, Robert Schelling, is the orthodontist in this office. So we knew that we would be coming here because it's like family. But over the last 3 years, we have experienced and witnessed just how great Dr. Maye is with all the patients and their parents and their families. So we've noticed how he always makes the patients feel important, and when giving news, whether good or bad, to the parents, he always makes the parents smile at the end, and they know that they're in good hands.
So we'll see you back here in 8 months or something, right, buddy?
That's right.
Rachel, how long have you been taking Emily here?
We've been here for about 3 years, so we've been very lucky to have been part of this for about 3 years.
What's your favorite thing about coming here?
I like when they clean my teeth and I like the foam when they put it. It's kind of fun.
Does it taste good? So kids are actually having fun at the dentist. Healthy and beautiful smiles all around without stress for the parent or the child. What a great discovery we share with you. Until next time, I'm Brie, uniting you and your families with the world, one video at a time.